Hello, dear listeners. Welcome to another episode of Follow Your Path. My name is Abdul Abid, and I'm a surgical pathology fellow at University of Pittsburgh Medical Center. And today we will be talking to Dr. Joe Wiencek. He is an assistant professor of pathology at Vanderbilt University, and his specialty is clinical chemistry. I'm also joined today by a future pathologist, Meredith Herman. Welcome to the show, Dr. Wiencek.
Thank you for having me.
Starting off, can you please tell us a little bit about yourself, where you grew up, and where you went to school?
Yeah, absolutely. So I grew up in Cleveland, Ohio, greater Cleveland, Ohio to be specific. And I went to the Ohio State University. I studied chemistry. I thought about going into medical laboratory science, but I saw that I needed to stay in undergrad for an additional year. And I was like, okay, I need to just focus on chemistry. It was interesting. I graduated in 2008, right at the time that there was the financial bust in the United States. And honestly, job security was hard to come by. I went on a lot of interviews, and I was kind of like tossed up between working kind of this entry level job within Cleveland and potentially going either to medical school, pharmacy, or completely something else. And so I stumbled upon a program in Cleveland, Ohio that was master's specific. And so I entered in there, and it happened to be clinical chemistry. Now, fun fact too is I'm quite interested in actually history, and so I started researching about the history of clinical chemistry when I started there, and found out this was one of the first programs that ever existed in clinical chemistry, from a master's and a PhD program. Um, and it's actually one of the last remaining programs in the United States. So started there from Ohio State, and then I started doing my graduate work at Cleveland State. And what kind of kept me in clinical chemistry before jumping off into medical school or somewhere else, and maybe in pharmacy, is I actually went to go see an autopsy. And so this may be from a medical student standpoint or a resident standpoint, maybe second nature in a sense, but as a chemist coming out from an undergraduate bachelor degree, I saw probably a third of the autopsy, almost fainted, and I was like, okay, I'm going into clinical chemistry from there on out. So it's kind of how it started for me getting into the field.
That's great. I know autopsies are not for everybody, and I think we've all experienced that at some point. But I would like to ask you, along your path to clinical chemistry and
When I think of this specific question in general, there's one person that really has stood by myself and as well as a lot of other graduates from our Cleveland State program, and that's Dr. David Anderson. He was specifically trained as a PhD and then went into a fellowship at Mayo Clinic. And he was to take over the successor for a position as the program director for clinical chemistry at the Cleveland program. And he just lives, breathes, and thinks clinical chemistry and how to promote the program as well as the graduate students that are there. And so we just celebrated actually this past year at our national organizational meeting, and it was our first actual inaugural kind of celebration of it, but we hit 100 graduates from the program that have entered the field for clinical chemistry, and they're at all kinds of academic facilities all across America and elsewhere across the sea. So,
Oh, wow. What an institution. So if you had to talk to a medical student who is path curious or someone who is an incoming resident, and how would you pitch clinical chemistry as a potential career?
I think that's a really great question too. First off, is clinical chemistry sometimes is maybe thought maybe as a second hand to pathology. It's not necessarily something that comes to the forefront of maybe what you would think from a pathology standpoint. However, the potential jobs that are available that are afterwards, the ability to combine this fellowship that is available for med students afterwards, and potentially others within pathology is really amazing, and it allows you to kind of and what I've liked to say to other people is and whatever potential other subspecialty, you're going to be able to potentially be very marketable. Now, one of the big factors that I think is interesting for you all from like residency and med school standpoints is that you're able to provide professional billing. And at this current standpoint in time, PhDs can't. And so therefore, sometimes these candidates that have clinical chemistry training potentially will actually gravitate and be higher than a PhD for this. And so money aside and potential professional billing aside, one of the things that I really like is the sheer scope and size of clinical chemistry. I mean, it is massive. At Vanderbilt alone, we do millions of tests a year. It's the largest area within pathology and lab medicine. It's one of the most expensive when it relates to equipment. One of our automation lines can be close to $2 to $3 million and upwards, depending on size and scope. So it's really interesting from the technology standpoint, the people that you get to work with, and then on top of it, it's the ability to get these kind of left field questions that come in from colleagues within medicine that are in reality, it's almost like a day-to-day puzzle. We have that come in, and then we, with our expertise, just go in and solve it to the best of our ability. And honestly, most of the time, it leads into a publication, which helps with your if you're interested in academia. You could work your way up through the instructor, assistant, associate, and full professor. So it's a nice way to publish as well.
Definitely. I remember there was a college class in the medical laboratory science program, and it was clinical chemistry class, and walked you through how, the different testing methodologies. So it's a very unique niche in pathology, especially if you like being in the laboratory and working with all the neat machinery and such. So can you share a case with us that you found interesting in your career in clinical chemistry?
Yeah, it's I did not pay you guys to ask me that question specifically, but I'm happy to actually share with you just a little bit of a tidbit, or and not too much of a spoiler for those that would actually want to read it. But just this month, this past month in October, the Journal of Clinical Chemistry released a case study of ours that looked into a complicated history of someone that was diagnosed with sickle cell trait. However, looking at specific things such as race and um, testing methodologies, there was a little bit of an interesting solution or kind of resolution that we came upon at the end of the case study and helped with patient care. So um, it, it, it's just really interesting to think about the caveats of lab testing and how they relate to the patient specifically, and kind of the puzzle that's there to be solved in each unique situation. So I would recommend, if anyone wants to read about that case, to go to the October issue of Clinical Chemistry, which is the premier journal for not only clinical pathology but also anatomical pathology, with an impact factor of close to 13. Um, and it was also featured as the cover article for the image art for the journal itself for that month. So definitely check that out.
Oh wow, wonderful. We will definitely do that, and we'll try to find a link and put it in the notes. So, as a clinical chemist, what do you find is the most gratifying aspect of your job on a day-to-day basis?
For me specifically, it happens to deal with that. The chemistry section of the laboratory literally touches probably almost every patient that comes in to get treatment or care. I think that, a common test that's ordered is basically the CMP or BMP, and making sure that the instrumentation that we offer in this lab is working, and by checking it through various quality assurance and quality control processes effectively, so that when those results hit to the clinician and as correct as possible, so that they can move forward in whatever treatment that they may have, or just a general checkup. So I think that's really cool. And then going again back on the day-to-day puzzles, I find that to be so rewarding. Honestly, one of the areas of medicine that if I didn't necessarily go into clinical chemistry or pathology, I would probably go into endocrinology. I think that that is another area of interest that pairs very well nicely with lab medicine. And it's nice too because we work so closely hand in hand with that specific practice.
Definitely. So, shifting gears a bit and talking about, your training and how to get to clinical chemistry, can you share a bit about the training and what, trainees should think about if they're thinking about going into clinical chemistry?
Yeah, absolutely. So the training is robust. I think that a lot of it deals too with not only the analytical methodologies that are there with the instrumentation, but really how to be a lab director. And so even as some of the folks that might be listening to this podcast right now, they'll be entering into residency programs, and most will probably go into APCP to make sure that they're, you know, be. The thing is you potentially, more often than not, will, because of that dual training, potentially be invited to actually be a director of a maybe small clinical chemistry lab. Since I started at Vanderbilt about 2.5 years or so, I've had about 9 or 10 pathologists that have gone through that type of training come back and ask specific questions to me related about QC, implementation of new specific equations within clinical chemistry, such as the EGFR CKD epi equation that doesn't have the race factor that was associated with earlier versions. And so, the training's robust. There's board exams. There's, I think, 7 or 8 institutions that offer this specific training past residency. And then there's other training routes that are a little bit longer, but there is routes to make them shorter, I believe. And basically, they're COMAC accredited programs, so Commission on Accreditation for Clinical Chemistry. And there's about 25 to 30 of them, and they're usually 2 years, and they'll treat you specifically, again, to the clinical pathology as well as the analytical methodology stuff. Um, and then you have a board exam that's associated with that COMAC accredited fellowship program. So
So, what advice do you have for residents who may be interested in clinical pathology? And would you recommend any resources that they can access easily for if they are interested in clinical pathology, sorry, in clinical chemistry, if they want to choose it as a fellowship?
yeah, I think that, when you're starting to talk about, potentially getting involved in clinical chemistry, maybe in the same manner that people may have deterred you away from pathology in general when you were in medical school, kind of get away from the naysayers or detractors in that and start focusing on the passions. If you really liked chemical pathology or chemicals in general, clinical chemistry might be the right home for you. Not to mention, you have the ability to do other subspecialties and maybe do a secondary fellowship, such as molecular genetics or hematopathology, even other to, again, potentially choose a location versus others. For resources wise, I think the American Association for Clinical Chemistry is a great kind of resource that might be available that has, great networking aspects that you could potentially utilize to kind of get a little bit more information. Also, if you'd like to see some of the research that's being done by chemical pathologists, clinical chemists, and other lab medicine specialists, use the Journal of Clinical Chemistry. It's a great resource to see what types of things are being studied and that are really pushing the forefront of our subspecialty within pathology and medicine in general.
Just one supplementary question to that would be, what can you recommend any resources for if someone is interested in lab management?
Yeah, lab management. I think that one of the best resources that you can probably utilize is actually there's two. There's the American Society for Clinical Pathology. I think they have some really good courses on lab management. Secondary to that, I actually tell all my residents and any medical students that rotate through our Vanderbilt fellowship, or I'm sorry, our Vanderbilt kind of like rotations that we have for clinical chemistry is actually to read Harvard Business Review articles. So some of the soft skills that I think that we don't necessarily get a lot of training on during our, fellowships and our graduate work and all that other stuff, but like time management, how to be mindful of the things that you do. Focusing on difficult like conversations, feedback, things like that. I think Harvard Business Review is a really great aspect to kind of start thinking about management principles when it comes and applies to your actual lab that you'll be working with.
Oh, cool. That's wonderful. Thank you very much. So that's our show for today, folks. You can find Dr. Wiencek on Twitter. His Twitter handle is at DXSTE WARD, DX Stewart. Thank you very much for listening to us. If you like the show, please like and subscribe our channels on YouTube, Apple, and Podbean, and we'll be back with another episode soon. That was